Okay, let's start. Good morning, everyone, and thanks for joining in today. We're going to be looking at starting learning outcome 2 today for the unit that we are studying, which is structure and overview of health and social care sector. Now, what you see on your screen is the unit specification, and as always, what I would like to do is obviously give you a bit of a brief overview of what learning outcome 2 actually consists of. And then what we will do is get into the detailing of it to cover some of the assessment criteria. Now, with regards to learning outcome 2, what we do see is that it talks about understanding the provision of health and social care, specifically in terms of the early ages or stages of human development. So this is the key concept that we need to be looking at studying today. And when we do talk about stages of life in general, or in terms of what are the different stages of human growth and development, and how does our healthcare system gear up to essentially providing that particular support when we do need it at the initial beginning, is what we're going to be looking at studying. So there are a couple of assessment criteria in this particular learning outcome that we're going to be going through. There are four of them in the past: one merit and one distinction. Merit and distinction normally tend to be an extension of one of the past tasks, wherein it asks you to do analysis or evaluation or some sort of critical evaluation, which is related to you actually building up arguments and presenting positive, negative side, pros and cons, or essentially arguments to elaborate on that particular part. So the first one that we are going to be looking at is talking about outline the points at which health and social care provision may be required during our lifetime. So here we're going to be looking at various stages of human growth and development, and at what stage, what kind of support is generally provisioned within the health and social care sector, what kind of support do you need. An example of this essentially would be when you do look at, say, for example, when you do look at your old age, you might need certain support in terms of social support, which would come in from social workers. There could be support you need when you're diagnosed with, say, for example, a particular illness or a particular type of disease. Then in such cases, what kind of support would be available at what point in time of your life. So here we're going to be looking at provision of what support you get when you're a child, when you're in a teenager, when you're an adult, when you're obviously in your working life, and then at some stage when you do retire and you become a senior citizen or an elderly, then what kind of support do you get, on that aspect. The second one would look at talks about describe the health and social services required and provided at different stages. And this is more of an elaboration to what the assessment criteria 2.1 is, wherein it will talk about what kind of here, what we will do is when we define the 5 stages or 6 stages of human growth and development, at each stage, what kind of support is required, we'll be actually detailing it out, as we go along. So it's not going to be talking generically, but we'll be looking at, say, for example, if you're a child and you're an infant, essentially from the time you're born, say month 0 to say year 1, what kind of support or provisions does the health and social care system have? Things like vaccination, things like initial care, which is required when you're growing up as a baby, from being an infant, from just being a newborn to an infant and to a baby, when you start crawling and obviously walking. Then the third one would be explaining arrangements of long-term care provision. So when somebody falls ill or when you're diagnosed with some sort of a illness, maybe a terminal illness, say for example, in such cases, if you require long-term care, then we'll take up an example and talk about what does long-term care mean. So for example, if you are diagnosed with an acute heart disease, or say for example, you have a condition which is related to, say, cancer, then in such cases you would require long-term treatment and support. And what would that look like is something that we are going to cover when we do talk about the third assessment criteria. The last one talks about explain how services are accessed at each stage, in a chosen country. So here, the idea would be from the 6 stages of human growth and development that we discussed. The idea would be here to take an example of one of the stage, and then with the provision of discussing it between England and Wales, or primarily in England, the idea would be to talk about what kind of provisioning is available in terms of support. Now, in the merit criteria, we talk about barriers which could impede that particular support that is required, whether you get that from nurses, social care workers, you get that from the community service or community healthcare services, from any sort of a setup within the health and social care like the NHS, hospital, A&E, pharmacies. Then what could be the barriers which basically impede or kind of prevent you being able to get that support in that stage of your growth and development. And then the distinction criteria would look at how these barriers can be overcome. So here we have to look at talking about examples of how we can overcome some of these hurdles which we are facing when we look at, say, for example, if you've not got access to medication, or if you've not got access to GP, like in the past we have seen and heard in the news that GP appointments have become quite difficult to get. There are, in most cases, in most surgeries, you have a queuing system in the morning, you have a walk-in surgery, you have a callback system in which the doctor would normally not see you but call or speak to you or give consultation over the phone. And what we have seen is that there has been a lot of discussion about the access to your GP at the local surgeries of that where you're registered. And what we want to look at is, we understand the problem that most patients see their GPs once in 3 months, but why is it that what are the factors which actually prevent you from being able to see your GP at your local surgery, and why does it take that long to get an appointment? So here we have to examine the reasons, or hurdles or barriers, whatever way you call it, that we need to look at, understanding that what could be the areas which could essentially prevent us from seeing the GP if we do need to, and why does it take that long in terms of getting appointments. So here in the distinction criteria, we have to think about how do we, one, what are the barriers and how do we overcome these barriers. So what is it that the surgery is doing essentially to reduce that time frame or make sure that the appointments are available. And in some cases, some surgeries, or when I say some, just as a very brief example, a lot of surgeries have now implemented what is called a callback system, an effective system through which you can book appointments on the website, ordering repeat prescriptions, some of the processes which can be essentially, driven through efficient systems in IT have been done. Say, for example, you have an appointment with the GP at say 12:30. You come in and you check in into the system, and you know that you're going to keep your appointment, and that way it allows you to see the GP. So there are some examples that we will take up, and these examples will essentially tell us how do we overcome some of these barriers that we see, which are preventing us from getting the care that we need during the phases of our, or different phases of our growth and development. So, in order to discuss obviously today's learning outcome and the associated assessment criteria, I've got a presentation. In fact, what I've done is, for this unit, I've revamped all the presentations. They'll all be up on Moodle after this session. And what you're going to see is that they are more updated, they are more to the point and focused on the indicative content. So if you want to look at the learning outcome 1 presentation, which was covered last week, that will also be a newer version. I'll let the older version remain because that is where the recorded session use that presentation. But in addition to that, you'll be able to see the new presentations for learning outcome 1, 2, 3, and 4, and they'll all be named LOs. Along with that, you'll have a hyphen 2024. So they would be, I would say, a must read, because that is what we're going to go through in the discussions in learning outcome 2, 3, and 4 when we have these sessions. So this week, just to also share with you before we get into the session, we have one session today and there's one on Friday, same time at 9:30. So on Friday, we'll be looking at covering learning outcome 3, and next week we'll be looking at covering Wednesday learning outcome 4, and that'll be followed by a assignment discussion session next week, Friday, which will bring this unit to a close. So This session is going to be slightly longer, I would say about an hour or so, simply because there are lots of assessment criteria to cover. So please be patient. Feel free to ask me questions through the chat route. If you're not asking any questions, I would suggest that you keep your mics muted so that there is no background noise. For those of you who are going to be listening onto the recording, they will get a clear and I would say a noise-free session. So let's begin in terms of our discussion today. What I want to do is obviously there's a fair bit of indicative content that we want to look at in this learning outcome. Most important around which all the assessment criteria will revolve will consist of things related to different ages and stages of life in in the case of human and growth development. So that bit is what we need to understand. There are identified stages through which every human goes through, which is infancy, early childhood, you have adolescence, early adulthood, middle adulthood, and later adulthood. So these are 6 stages that we are going to be looking at in terms of understanding and obviously building our understanding as we go along to cover some of the assessment criteria. Now, there are also things that we need to relate apart from understanding the main concept of different stages and I would say different ages and stages of life. But what we want to do in this unit is to basically relate what kind of services does the health and social care sector provide at each of these stages when we do need some of these services. For example, I'm in my mid 40s and I don't need much support as of now, but as I begin to grow old and I go into, because of age, I might develop certain types of illnesses or conditions which might need support. And in such cases, what I'm interested in finding out as an individual is how would my surgery, my local GP, my pharmacy, the hospitals and the A&E would support me when I do need that service. So that is the key critical part of it. What we need to understand, we need to understand this different ages and stages of life, and then match that with the kind of provision which the health and social care services, mental health care services provide it at each of these stages for us to be able to, make, obviously use and at some stage, look at using those services so that we are able to, get back onto our feet or essentially, do go about our usual routine on a normal or a daily basis. Now, this particular picture that I've got in front of me actually shows these 6 stages, but slightly on the infancy and the childhood side, these stages have been broken down into 3. So we call the infancy stage from 0 to 3 months. We have, the infant or the baby growing between 4 to 11 months, and then, between 3 and 5 years. So between the ages of 0 and 2, early years is what we call it. It's basically one stage. Then you have the teenage, wherein you're in early, childhood, and that will be between the age of 6 and 13. Then you go into adolescence, which is 14 to 18. Early adulthood, 25 to 45. Then you look at middle adulthood, which is 45 to 65, and anything over the age of 70 would be, later adulthood, or I would say, essentially, you are in you're a senior statesman or you're an elderly. Now, there are different lifespans, obviously, for different lifespans which are predicted for population across the United Kingdom. So when I look at the average lifespan of an individual in United Kingdom, it could be for women 73 years, and I think for men, or the other way around, for women 78 years and men 73 years. But this could vary between
Uh,
England,
hello,
Wales, Northern
hello.
Ireland, and obviously, Scotland. Yes, Lucky.
What unit are we?
Unit 1.
Okay, thank you.
So essentially, this is something that we need to be coming to grips with to understand how are the different ages and stages of life classified and accepted across the globe. So obviously, lifespans are different across different geographies in different countries, but we are focused in terms of understanding that across predominantly, England. Now, There is a good video which I've shortlisted from YouTube, which I would suggest that you watch. It's a 5.5 minute video, which basically takes you graphically with some voiceover through different stages of human growth and development. And they talk about these 6 stages that we are going to be looking at in this particular learning outcome. And watching this video would essentially also give you, it's about 3 minutes and 40 seconds. Sorry, I shortlisted 2, 3 of them, but finally use this particular video because in a shorter time, it basically gives you a very good understanding of how these stages develop and what happens at each stage of development when you go through that. Now, we'll talk about it, through some slides first, just to understand the overarching message of this particular learning outcome, which basically focuses on the different ages and stages of, I would say, human growth development. So here, what we are looking at essentially is that what we want to do is understand that if I'm growing up and I'm at a certain age, what are the kind of services, when I say services, what are the kind of health and social care services which the Department of Health actually organizes and provides to me as an individual or as a member of public, so that I can go on about doing my daily routine or the usual functions that I do. And at each stage, there are very clear documented guidelines in terms of what would be the services which would be provided by the NHS or National Health Service, and that is what we need to be looking at to understand this. So if I ask this question, what are the healthcare services? So can somebody just tell me very briefly or come up with some ideas in terms of when I say healthcare services, what does that mean? This is something that we've covered in the first learning outcome, and we looked at it in this third or the fourth slide of the first learning outcome. Any ideas in terms of what are the healthcare services that we talk about? All right. So when we do talk about healthcare services, what we're looking at is, if you recall, something that I mentioned, that we get primary care, we get secondary care, and tertiary care. Now, primary care is normally a basic health service that is provided through the GP surgeries, pharmacies, community care centers. You have secondary care, which is provided by hospitals and A&E, and tertiary care, which would include community services, local councils, and other forms of agencies, private public partnerships, which will be providing care when it is required after post-operative, surgery or for long-term basis. Now, when we do talk about healthcare services, this is one classification. The second way of classification would be to look at services which are related to, healthcare, which could be mental health care, which could be dental health care, which could be, substance misuse. For example, people who are on addiction or alcohol or drug or other things like that. There could be services which are basically geared to provide or from services from the National Health Service, which are geared to provide people with disabilities, support so that they can get on with their normal routine functions. You have services which are provided through occupational health and safety, which could be physiotherapy and things like that. And then you have, services which are also provided in the early childhood years, infancy, and I would say childhood, which is when mother goes through the process of being, through the process of gestation or essentially, I would say pregnancy, and prenatal care and postnatal care is provided. And in such cases, this is what I would term as what are called healthcare services. So when we do talk about healthcare services, what we need to be now able to do is, if I have named a few of them right now, or types of these services which are provided by the National Health Service, what we need to be able to do is basically fit them into categories which would be related to these services which we receive at different ages and in different stages of our life. So when we do talk about these different ages and different stages of services during our life, the first one that we do look at is the early years, which is infancy and childhood. Now, in this, if I just wear my thinking hat on and talk about some of the services that I received from the time of birth, I would be looking at services which include things like vaccination. So most children get vaccination within 40 days. Then after 3 months or at the end of the year, when they're coming up to 11 months to a year being old, they would get certain vaccinations which are important, to prevent I would say, gestation of diseases like polio, rubella, mumps, and diseases which typically have become, let's say, there are no signs of these diseases being present in the United Kingdom, but as a precaution, some of these vaccinations are given because these then tend to develop immunity as you grow and become an adult, because these vaccinations typically do not allow these diseases or illnesses to set in. Now, apart from that, you also receive regular screenings. You go through weight measurements. If I look at, having my own children at some point in time with my wife, I've seen my children undergoing, regular checkups. There's a red diary or a book which was maintained, for the child till the child was about 4 years old. And that particular book had a record of every sort of measurement related to, what was taken by the nurses, the GPs, and specialists, working within the sector. So, for example, weight measurements, looking at vaccinations when they were done, height measurements, looking at noting down key points in terms of when did the baby start crawling or when did the baby start walking, and things which were related to what were the major illnesses which the child had at the initial ages, and that essentially, were all a part and parcel of, allowing, essentially, or basically, making sure that all these things are essentially, available, or I would say, noted down during the early years of the growth and development, for the child. Now, when we all look at these type of services being provided, sometimes if we have children which develop certain things like allergies to peanuts, or certain types of conditions which could be diagnosed, as they are growing, then in such cases the National Health Service also puts forward support and services which would allow the child, or the infant in this case, then early child years, to be, as normal and progressive as possible. So in such cases, you would also see that children would receive, services if, for example, let's look at a practical situation. If the parents divorce, or if parents pass away, or if there is an act of God, that in such cases children are taken into foster care, and obviously they would still need to get the same level of support. But what the local council and the community's healthcare service would do is essentially, along with local authorities, is to ensure that if they are put into foster care, or if they are, put up for adoption and things like that, they would ensure that they go into a family wherein the full support system is available. And, obviously, in some cases, it will also put together services which will be required, with children which are born with disabilities. So, in such cases, specialized care would be arranged, which includes things like therapy in some cases, and in some cases, for example, if children develop a disability for hearing, then obviously hearing aid, or things like that will, or in terms of, provisions, would still be made available, for the purposes of ensuring that support is available during the early years of growing up as a child, and they would then allow the child to develop into a normal, healthy individual, which means that they would be able to take care of their daily routine, and obviously able to function, going forward as a normal human being. Now, these services obviously go into what are called services primarily into adolescence, which is teenage years. And when we do talk about teenage years, what we are looking at essentially in this case is, services which are primarily provided to children initially in the age of, between 6 to 13. And what we would see is things like, some part of it relates to obviously every kid being entitled to schooling. So there are lots of programs, and obviously children go into primary and then go into secondary school at this age, and what they are going through is a system of learning which would ensure that they get also general health guidance in terms of how to maintain good health care, and obviously ensure that they are, say for example, they have access to meals. In some cases, if I give an example here, would be that if we do feel that children come across from disadvantaged background, or if their parents uh, are on income support, then free lunches in schools, or free healthcare services up to the age of 16 is what the NHS provides. There is no prescription charge, or obviously services which they would need to pay for, say for example, medication. And a lot of educational programs are run through the schooling network, wherein they are able to pick up guidance on how to maintain general healthcare or good general healthcare as they are growing through this particular age. Now, during this transition period, obviously, the local councils and obviously schools and in general the community healthcare services provide support, which would mean that they are going to develop into individuals, and they would also have a very good understanding of how they are able to maintain long-term health, general health in terms of maintaining good general health over a point in time or from a long-term perspective. You then look at obviously young adults between the age of 18 and 25, and adults between the age of 26 and 34. So the years can vary slightly in terms of how we would classify them. But essentially, looking at these six stages, we are looking at somebody growing up to be an adult. And in such cases, some of these services change from being into normal services to being services wherein they would need things like, education on sexual health or substance abuse. They would also need sometimes journal screenings, for example, things like, if you recall the COVID pandemic, obviously the vaccination drive, when it started in a reverse way, wherein the vaccination started with the 80 to 90 years old, then it went down to 70 to 80 years old, then to 60 to 70, then 50, then 40s, then 30s, and then finally, going into children. So when we look at these services that are being provisioned, they are being provisioned to ensure that due care is being provided when you're growing up and you need those services, and they are prioritized depending on the vulnerability that the person or the age group would have. So in such cases, contracting COVID, or contracting that particular disease, adults were more vulnerable, and that is where the vaccination drive by the NHS started with the elderly, and then slowly and gradually progressed standards onto the other years, in terms of members of public. So children were allowed to be vaccinated simply because, one, the vaccine needed to be tested. Second, they were not vulnerable or as vulnerable as the adults to the COVID virus. And the last but not the least, the recovery, even if the virus infected or affected the children or people at the young age, they were not severely affected. And then that is why in some cases, this care was prioritized towards adults, or in a decreasing order in terms of age groups, in terms of the vaccination drive. So in every slide, you would see that we classify these services into three types: healthcare, social care, and obviously, if you see between early years, it was specialized support. If there were disabilities detected in adolescence, it was the transitional care. If it was required from being moved from pediatrics to the adult services, when you had the the red book was done away with, and obviously you had regular checkups with your local GP and the surgery, once a year. Then when you look at young adults, it is employment and housing support, which is where the government steps in, and the health department steps in, to look at providing those services which are related to health and social care or mental health care. And when you look at adult, it is normally related to occupational health and rehabilitation. Things like if you go undergo a surgery for the knee, hip replacement, you have heart surgery, or you have surgery for certain terminal illnesses. Then in chemotherapy, for example, for cancer, then in such cases, you would probably have services that will be, once you've had the, treatment, then these services would be required for you to rehabilitate, or obviously, get better. And in such cases, recovery becomes more important when we look at people in the adulthood. And last but not the least, when we look at the term that I used earlier, which was middle adulthood and later adulthood. So anything over the age of 65, you would see it requires services like end of life and palliative care. And there is a bill which is going to be introduced in the Parliament, which would support some sort of an end of life care or an end of life act, which is obviously in some countries in Europe already there. But in England and Wales, obviously, this particular bill, is being brought across in the Parliament, and this would be applicable across the four devolved nations in any case. But that would mean that when you're nearing your end of life, you need, what is called palliative care, and that palliative care essentially, looks at, providing you, I would say, let's say it would be a service which would be a medical approach essentially that would help on focus on essentially improving the quality of life when you're at that stage wherein either you're diagnosed with terminal illness, or if you are at any stage in a form of illness which has been diagnosed, and different forms of treatment in conjunction with the treatment for the main disease or diagnosis which has been done would be provided in conjunction with some of the other treatments that you would need. So an example here would be that if you have people who are elderly, sometimes they have had a knee replacement, but they also have an acute condition of being diabetic or having a heart disease. So you have multiple conditions, and in such cases, palliative care aims to prevent and obviously treat symptoms which could have side effects of diseases and its treatment. It also provides psychological and support for I would say operative procedures, but at the same time it would act as a system wherein the family and the close members of family would also be involved in providing care as a carer and things like that. And that would be something that you would get to see when people go into adult or later adulthood. And then there is support which is also provided by the National Service, which is support when you're transitioning between these different stages of, different ages and life stages. And this transitioning would essentially, this support would essentially be looking at transition, because in such cases, individuals would need certain support. For example, you've had a good adulthood and you're transitioning from middle adulthood to late adulthood, but you're diagnosed with certain things, say, for example, Alzheimer's or any sort of medical condition. And in such cases, you would need therapy and support. Instead of sometimes, that support could be related to non invasive procedures. That means you do not need any sort of a clinical or operative procedure. You might be absolutely fit and fine, but you might need support in terms of therapy. And in such cases, when you're transitioning, sometimes we look at this particular support being given to women specifically when they have menopause after the age of 45 or between the age of 45 to 50. There are different symptoms that they face in terms of their body, their hormonal systems changing in the body. And in such cases, support that is provided to women, say, for example, another example could be if a man undergoes some sort of cancer treatment, say for prostate and things like that, you need a transitioning support in order for you to get back to your normal things. And in such cases, you would generally see these kind of transitioning support or the development of what is called the integrated care system, ICS, which was developed within the NHS, looks at working together with authorities. And the structure that we looked at in terms of the first learning outcome, you have the CCG groups, the PCCTs, the local authorities, the councils, and obviously private public partnership in terms of different providers working together to ensure that integrated care is provided, to the individuals. Another example that you could look at, is some sort of bereavement support or hospice care, which is sometimes provided, and that is when you're transitioning from one particular, life stage to the other. So those are the important bits that we want to look at in general terms when we do consider, different ages and stages of life. And the healthcare system that we have in the UK the health and social care system that we have in the UK is designed primarily to cater to all diverse needs of the individuals, and that system caters to the different ages and the stages of life through which you are going through, and there would be appropriate support and services provided at each step of the way so that you are able to get on with your day-to-day functions and your routine as far as being a normal individual is concerned. Is that okay? Any questions on this so far? So this is the main, overarching message in the learning outcome that we want to look at, and I hope
No
this
question.
message is well understood. Any questions at this stage?
No question.
Okay, thank you. So let's go into some of the assessment criteria now, which is to look at the first one, which is outlining the points at which health and social care provision may be required during lifetime. So here, some parts of it, what we need to be able to do is now look at detailing in terms of what kind of services or I would say um, support that we get when we are going through, say, for example, different stages, the 6 different stages that we are talking about. So first and foremost that we look at in this case would be when we do talk about the health and social care provision at various stages of person's life, what we are looking at is the changing needs according to the age, the health, and the circumstances the individual might have would be required to be studied and understood. So here, the outline that we look at, primarily when we talk about birth to early childhood, which is 0 to 5 years, our health needs would be, for example, regular checkups. It would be monitoring of our growth and development in terms of height, weight, our organs, and our body and structure growing. So sometimes you would see that when you visit with your child to the surgery, there are measurements which are taken for harms in terms of what is the rate at which the body is growing, the legs, and the weight and height in terms of the child. And these could be important signs because the reason why this is being monitored is because this would provide important signs and signals to the practitioners to understand if there are any early childhood illnesses or disorders which the children would be facing. And in such cases, if they are discovered or detected, I would say, then appropriate support would be provided so that these conditions could be avoided in terms of medication, in terms of say for example, parental support services or education services to ensure that families get the assistance for children if they are showing any disabilities or any sort of such disabilities which would need that support to be put in the initial years so that it becomes the child does not feel this as a disability, but at the same stage, is able to cope and learn the techniques to be able to cope with that disability. Then we talk about, years between, I would say, 6 to 12, which is, I would say, adolescence. And here the focus is on things like medical checkups, which would include dental checkup in particular, because you're growing your wisdom tooth and you want to, the service would be more focused on checkups, which it could be dental tech checkups, for example, essential part of any vaccinations which need to be done, education on sexual health, mental health support, and addressing issues in terms of eating disorders, which could be, sometimes requiring specialist medical care. Say if one of the conditions is bulimia, wherein you get that condition wherein you become attuned to eating a lot of food, and in such cases, those conditions would be, the signs of those things would be detected when we look at providing these, checks. And in terms of social care needs, you're looking at, support for things like identity development, coping with stress or, harassment or bullying or, in training on safeguarding. Those kind of things would be of importance during this age because here at this stage, you're looking at developing life skills and you're looking at focusing your development on career and growth. And in such cases, family support in terms of I would say education and mental health services is provided to individuals so that you are able to go through that period as a normal individual. Then we talk about, early adulthood, and in such cases, your main health needs that we do talk about is things like you're either, obviously looking at regular checkups, but in addition to that, you're looking at, things like anxiety and depression. You're looking at signs to detect any sort of, habits like smoking, looking at, I would say, substance abuse, and journal part of it is to do with education. There is a good amount of focus on education to ensure that you follow good practices when you look at sexual health, you look at substance misuse, you look at, weight management. And the idea is to look at providing information on preventive care so that as adults, as young adults, you're able to understand the difference between what is good and what is wrong, what is right and what is, wrong. And in such cases, guidance and support is provided both through your workplace, if you're working, if you've started to work, and in terms of, general training and programs which are normally done through the pharmacy, or for example your local GP surgery, or the community healthcare services in your neighborhood. And then when we talk about adulthood, which is middle adulthood, I would say here the focus again is on preventive care, because regular screenings for what people undergo through diabetes, you look at testing for smear signs in the case of women, for cervical cancer, you look at prostate testing in the case of men for prostate cancer. There are certain conditions or chronic conditions that, you know, um, uh, we are aware of, which obviously need regular screening at a certain age. And in the middle adulthood, the focus is on preventive healthcare and screening of these conditions and diseases, things like cancer, breast cancer, for example. And the idea there is to also provide support for services like, menopause in the case of women, and also therapy related services, which would be covered under social care needs, because caring for aging population, for example, or elderly in your family, how to maintain a work-life balance, looking at financial support in some cases, and also ensuring that people, if they are going through midlife crisis or some sort of changes in their personal life because they've had a divorce or things like that, that they would be the services which would come under social care services. And then when we do talk about late adulthood, we will be going into, services which are related to regular medical assessments, because they would be looking at diagnosing age-related health issues like dementia, osteoporosis. You're looking at arthritis. You're looking at, knee care, or for example, acute heart diseases. And in some cases, it could be multiple chronic conditions which would need hospitalization, and that kind of care and services are essentially important when we look at late adulthood, which is beyond the age of 65. So in this case, social care services essentially would look at how would people be looking at living independently, for example, or would they need to be transferred to a care home, or would require social services to visit regularly to help them do their daily course. And in such cases, if there is development of terminal illnesses like dementia or Alzheimer's disease or frailty, which is because in the old age you become, your body becomes frail. And in such cases, housing adaptations or mobility aids which are required for the elderly would be the assistance given through local councils and obviously community healthcare services in your area, and they would be, important. And then when we talk about the end of life palliative care, which is the seventh stage that we are adding, is that here you might need, you might have multiple chronic conditions, and that is where you would need multiple types of services, which could include hospice care, or it could include conditions wherein you're emotionally dependent, psychologically dependent, and you would need support from both your members of family, oblique social services, and after that, obviously, services related to funeral care and, I would say things like, if there's a bereavement, then counseling services for families, and in some cases, even support beyond that if it leads to any sort of dispute, if there's no will or things like that. So those are the bit of services that would be required and are provided by the National Health Service when we talk about health and social care provision during the lifetime of the individual, during the different ages and stages of life that you go through, from being born to, end of life. And these are the kind of services which the system would be geared to provide to the individuals as members of public. Any questions on this? Right.
No.
Let's move on to the second criteria where it talks about going into a bit of detail in terms of describing some of these health and social care services that we need at different points, in our lifetime. So here, when we do talk about these services, we are going to talk pretty much the same, but what I would do is we would go into a bit more detailing of
Yeah.
the different services, which would mean when I talk about, health needs and when I talk about social care needs, but I would talk with an example. I would not talk generically. So I know that in the early assessment criteria, we talked about what kind of services can be provided, but here we would need to take up examples to define and describe these health and social care services. So it's pretty much the same, but what I would want to do is basically give one or two examples. Yes, some Lucky in the background. Yeah, do you have a question? Okay, so in such cases, what we are looking at primarily is that we are looking at going into a bit of detailing of each of these services, and each of these services essentially, with an example. Not talking descriptively, not talking generically, but here the idea would be to talk about, them with an example. So when we do talk about some of these, services in terms of different ages and stages of life, then here what we are saying is that if we have to look at giving an example in terms of, what would be these kind of services that I would need. So, if, for example, if I talk about one of the age groups, so let me just give me 1 second. So let me talk about a particular example in terms of, just give me 1 second. So let me just try and bring up a example that I want to look at. And that example that I want to look at is, you know, talk about, so that example that I want to talk about is, say, for example, if we take up one particular stage, and in that one particular stage, we do look at, say, old age or adulthood, then in those cases, what I would need to do is basically, if I look at this particular group, which is, the fifth or the sixth stage that we talk about, which is later adulthood, then in this case, we would look at examples of these services. So, one, for example, when we do talk about geriatric care, so when I talk about geriatric care, what I mean by that is that geriatric care or medication typically tends to be focused on very specialist care which is being provided to an individual. Now, the term geriatric originates, from a term or word called old man. Now, here, this particular term is used when we look at some sort of treatment which is being given specifically focused on, sorting or solving a particular health need of an elderly. Now, when we do talk about, geriatric care, what we are also looking at is that it's the study when we talk about gerontology, we are also looking at studying of aging. Now, it includes both biological support, sociological support, and psychological support. So, here the example that I would want to basically mention when we talk about support being given in later adulthood, people who are over the age of 65, that would mean that they have a chronic illness, they need to sustain their independence, and in order to sustain their independence, they're also looking at improving the quality of life. Now, there could be conditions like dementia, arthritis, and frailty that I've mentioned on the slide. Now, in some cases, in order for individuals to get on with their day to day life and functions, what we could do in terms of the health and social care provision would be to talk about services which individuals can be provided. And one of those services that individuals would receive or can be provided would be services related to, I would say, home based healthcare services. That means a social care worker visits daily, helps the elderly in the daily chores like bathing or change of sheets or cooking and some of the other day-to-day functions in the house. And at the same time, what we'll also see is that if they live with the family or if they live alone, then in some cases would they be looking at doing the daily tasks on their own, like cooking, bathing, dressing. And in such cases, if this is not possible, there could be changes which would have to be done within the home from a point of view of accessibility. For example, they have arthritis or they have knee pain, and it's difficult for them to go upstairs, or because the bedroom is upstairs. So in such cases, home care or residential care services would be proposed by the council, and the adult would be given an opportunity to move into an old age home wherein they have I would say more or less 24-hour supervision and support provided for by specialist professionals or support workers. So what we need to do in this particular learning outcome is to primarily take an example of one of the stages of life, and then what kind of services or support would be required to be detailed out as an example needs to be discussed, and that would be going into detailing of describing the health and social care services required at each of these stages of life. Is that okay? Any questions on this? So I'm not going to go and discuss, examples of every stages through which, you go through, but the idea would be to pick up one stage or two stages and describe what could be the services with an example that the individual would need at that stage in terms of, health and social care services, and they are required and obviously provided by the National Health Service. Now, the next assessment criteria talks about, explaining the arrangements for long-term care. Now, one of the things that we want to understand is what is long-term care and what is the meaning of long-term care. So, if we look at long-term care has many, many different definitions. Now, this would, in short, if I have to talk in layman terms, would include a broad range of services that could be personal, social, psychological, medical, and support related services which an individual would need because they are diagnosed with some sort of chronic illness or have had a disability, a lifelong disability, or a condition that they have been living with for years, simply because that is something either genetic or birth related. Now, long term care aims to help individuals maintain the quality of life. That means they want to become independent, they want to be able to take decisions on their own, live on their own, do their functions, daily functions on their own. And in terms of ensuring that the care is able to provide them the quality of life, independence, and dignity, often is something that is the main aim of providing care through various authorities and people involved in the care services. Now, when we look at an overview specifically for England, here is where it starts with the assessment of care needs. So, if you're diagnosed, say, for example, with some sort of long term illness, then a variety of services that can be provided to an individual with, I would say, chronic illnesses, disabilities, or other conditions which can limit their ability to perform daily activities over an extended period would actually constitute, long-term care. Now, here the focus of this type of care is to look at, first understanding what care is needed, whether it's personal care, medical care, any sort of rehabilitation. Do they need home care? Do they need care within a nursing home? And that is what we need to look at when we talk about, assessment of care needs. Now, who is eligible and at what stage they would start getting this particular care, and what are the various types of care that they would get is something which would be first, diagnosed and discussed about when we talk about long-term care. Whether it's personal care, which is assistance with daily activities like bathing, dressing, and eating, whether it's medical care, which is ongoing medical treatment, which could require supervision, including skilled nursing. Say, for example, if somebody had a knee surgery or a hip surgery, they would need specialist care for the next foreseeable couple of weeks and months in order to get back to normal functions. And that would include personal care as well as medical care, things like sessions with the physiotherapist or attending some sort of classes to be able to, start to understand how to get back to normal. They might need I would say rehabilitation, simply because if you've had, for example, an accident or and that has led to some sort of, say, physical oblique, mental trauma, then in such cases you would need therapy, and that would mean rehabilitation, and that could happen for weeks and months. And in such cases, the idea would be to provide long-term care, but the assessment of long-term care first needs to be done. Then in the National Health Service, and obviously from a local authority point of view, the second most important thing is to look at setting up that long-term care. Now, in order to set that long-term care, the first thing which the government proposes and looks at, or the local authorities look at, is funding for that long-term care. Where will that funding come from? Now, part of that funding comes from, as I mentioned, when we looked at budgeting for the NHS, comes from the national insurance contribution. Part of it comes from the budget, which the government announces, and then it comes from charities or members of the public in terms of donations, and then several other types of public-private partnerships, which obviously create funding and support. But what you're essentially focusing on is, if this long-term care has to be provided, budgeted for, where will the funding come from? Whether it come from the family, whether it's going to come from the individual, are the individuals capable of paying for this funding? Would it come from insurance schemes, things like that? And they would all be considered before the long-term care is put into some sort of practice. Then the concept of integrated care services. So in such cases, you would look at primarily, when it is decided that the individual will need in-home care, or whether the individual would need assistance in terms of some of these services. Would the individual be transferred to a nursing home or a care home, or would they require a hospice care? All this bit would be considered, and then long-term care would then be looked at from a point of view of how it will be financed. Then what we look at in this case would be, once the funding has been secured and the long-term care needs and the integrated care plan has been created. Why integrated care plan? Because apart from the patient, the family members, the close friends and family and support system are also taken into account to ensure that they are able to play a role in the long-term care and support services for that particular individual. Now, once that is done, at some stage, this care would also then be approved, because we are following policies and procedures and legislation, set down by the Quality Care Commission, the local authorities. And in such cases, you would look at some of the acts that would be required to be followed in terms of procedure. So once this care is approved and the integrated care plan is approved, then this care is put into action. Now, unlike short-term care, long-term care is often needed for months and years, and it is something which could also be for a lifetime for an individual diagnosed with some sort of difficulties or disabilities. And depending on the individual's health, this long-term care also then is quality tested, means tested in terms of funding, to ensure that the individual is actually getting access to that care and is helping the individual do their day-to-day services or day-to-day activities, and it is helping the individual tide over that chronic illness or obviously some sort of illness which the individual has been diagnosed with, if it is not something which is from birth or in some cases genital. So this particular aspect of long-term care is designed primarily to ensure that the care plan actually meets the ongoing needs of the individual, both in terms of personal and social care. And in some cases, if the individual cannot do the day-to-day activities, then in those cases it is often seen that the local authorities and the national service and the social services step in to ensure that this is provision for, in terms, when I say provision, I mean it is funded, and this is something which is continuous. Now, one of the things that we get to see, for example, in terms of an example here, would be that when you look at early childhood years and when you look at parents who need support in terms of childcare, the government, the previous government and this government has also paid heed to that, wherein they've introduced, child support services up to 25 hours for working parents to ensure that children get the required supervision through nurseries or play schools, and that also allows parents to work and obviously go on get on with their life. So in such cases, this is a provision which, as an example, has been created by the government, considering not any sort of chronic illness or terminal illness or ongoing illness, but as a support system within social services, so that working parents can afford childcare services and put their children in some sort of a day school or nursery services up to the age of 4 till the time this children go to nursery or private primary school. And that is the role of how health and social care services looks at providing provision of these social services in the case of this play schools and day nurseries, as an example, from a point of view of members of public in the UK. Is that okay? Any questions on this? Right. The next assessment criteria talks about explain how these services are accessed at each provision point in your chosen country. So here in your chosen country, for us the chosen country is England. So what I would do when I look at these services, I would essentially be looking at going into a bit of, I would say, detailing, by again looking at the different ages and stages of life. And here, what I would look at is when I talk about the healthcare system in general, when we discuss England, what we are looking at is that at an early age, for example, when you're born, you're registered with the GP surgery. Up until the age of 16, you would get some of these services free of cost. But after the age of 16, you would probably be needing to pay prescription charges or, for any sort of services that you would take, from primary care, which is dental health services or GP surgeries. Then in such cases, you would be accessing these services, which are a part and parcel of the National Health Service, and this is where the system tends to work. So when we do look at organizing these services, we are looking at different provision points from a point of view of England. And when we do talk about provision points from a point of view of the system, what we are looking at is primarily the system through which we are looking at breaking down these services into various sectors, which could be healthcare, it could be mental health care, it could be social services, it could be educational support services, and the accessibility of these services needs to include eligibility, registration, certain processes. It'll go through some quality part of it to ensure regulation is followed, and then funding part of it from a government perspective and local authority to be able to give these services or make these services available to the members of public on an ongoing basis. It is not a one-time service, it is not an ad hoc service. So obviously funding part of it needs to be also looked at from a planning point of view, and that is what the provision essentially means when we access these services at different stages and ages of our life. Now, again, what I've done is I've drawn up some tables to discuss in a bit more detail. And when I say detail, to be very specific when I talk about these services. So when I say what is the provision for childhood care services, that would mean from a local authority perspective, education. That means school health programs. You have, if you recall, going to school, there were different types of programs, healthcare programs, or awareness days, which were organized. And obviously, these were days that were organized primarily from a point of view of ensuring that you are able to get the information and education so that you are able to, understand how the provision of these services is being done. So at early stages, what we do learn about is, say, for example, in the primary, in the secondary school, the first training or program that normally is organized by the NHS is, training on, for example, sexual health, and in such cases, in the schools, we see a bit of a drive wherein you have somebody coming from the NHS, maybe a nurse, and talking about this in the class, because you are at a phase in your life wherein you're having undergoing a transition, and that transitioning at that stage requires education and information. And in such cases, you would generally see, those services being planned and obviously, being provided to people, essentially who are, I would say when I say people, what I mean by that is at that stage, children are going through that particular adolescence period, and that is where they would need that particular bit of information to educate themselves on the obviously sorry on the their obviously sexuality or obviously their sexual health. Regular checkups are done, and those checkups are primarily ensuring that people have regular screenings, and if there are any issues, concerns, then they are discovered, and obviously rectification or medication is offered to the concerned individuals. Yes, anybody wanted to ask any questions? Sorry. Right. The other bit which we want to look at in this case is to just give me 1 second. I want to mute everyone's microphone. I don't know who that is in the background, but if you can mute your microphone, that'll be great. So let me just quickly explain again, and obviously what we have to do is ensure that everyone is able to see the slide. Just give me 1 second. Okay. So this part of the assessment criteria primarily is, focused on the detailing of essentially services which would be provisioned and which you would have seen receiving as an individual when you're growing up, and going through one of the stages of growth and development. And in such cases, what you would have come across as a service that you would have received either under healthcare or under social care services is what you need to be looking at, mentioning, and that could be done in the form of a table. It could be done, as in the form of a table with an example, and that would primarily help up in obviously covering up this particular criteria. Now we go across to barriers. This is the most important, part, because we've discussed to certain part of it being repetitive in terms of what are the provision or what is the basis of these services and how they are provided, how they are arranged, and how they are provisioned by the National Health Service. But now we are looking at a different element of these services, which is barriers. Now, what could be the barriers that we think of in terms of the provision for these services is affecting or not reaching you as an individual. Now, again, these barriers that we want to discuss are being discussed from a point of view of, the various stages and ages in terms of the life. So, various different stages of life. So, when we do talk about these barriers, we are talking about, hurdles, impediments, or any sort of difficulties which an individual might face, and the system might need improvements in terms of ensuring that these services are not being limited, or they are not being if I put it in a different way, that these services are reaching the intended individuals during the different stages of their life. Now, if we generally think of first some of the barriers, what could be the barriers that could inhibit these services reaching different individuals? Now, some of these barriers that we can think of would be, say, for example, one of the most important ones which can come to my mind is lack of information. For example, if there is no information available on any type of, say, for example, when COVID started, we had no information on this particular disease, SARS-2 virus, as we call it. We had no information, and as research and more information from different countries and the World Health Organization started to pull it together, then we started to build an understanding of how this virus spreads, why is it spreading so quickly, what kind of symptoms it causes in its, in its patients or individuals when it affects, and what could be the treatment which could be offered to the individual infected with the SARS-2 or COVID-19 virus. Now, there was a lack of information essentially in the initial stages. And a lack of information also led to, I would say, delay in prognosis, or I would say in some cases, even the development of vaccination or any sort of drive which the government wanted to start in order to control the spread of this disease. That could be one of the barriers, because there is no information available, because the humankind has mankind or human, as we put it this way, we haven't had this pandemic before. We haven't had this virus infecting or jumping from animals to humans and then infecting and then spreading so quickly. So there was nothing like this in terms of a pandemic that we have seen caused by this virus before. So lack of information could be one of the barriers. If you think of other barriers, the other barriers that I can think of could be things like cultural barriers. It could be language barriers. For example, sometimes you go into the NHS, and obviously, if you're receiving care or if you're undergoing a treatment, sometimes if you're not able to speak English, or English is not your first language, then you request for an interpreter. And obviously, in some stages of your consultation with the nurse, GP, or the consultant, they would ask you this question: that are you comfortable speaking English? Because in your background and in your profile, we do see that it's written that English is not your first language. So do you feel comfortable bringing somebody along with from within your family to be able to translate or help in interpretation? And would that be convenient? So in some cases, we do see language and the culture that we come from, or the background that we come from, could be a barrier. So in some cases, you see in certain cultures, women, if they have to go to the doctors, they normally are accompanied by a male person, and that is dependent on their culture. And so in some cases, if the male is not available, or you're not able to go in alone, then in such cases, that could be a barrier wherein it would delay treatment, or worsen the symptoms of your illness, and that could be a barrier which is primarily because of culture or language. Then one of the things that we do get to see in the NHS is shortage of staff. So after Brexit, we have shortage of doctors, nurses, health and social care workers, and that could be seen as a barrier. So when I say barrier, it could be barrier related to workforce or manpower recruitment, in terms of enough people being available, to be able to provide those services within the NHS. So when we do think of barriers, there are some generic ones or general ones that we can think of. Things like lack of information because of culture, because of background, because of language, because of workforce, or in some cases, budget sometimes tends to be a barrier. So in NHS, every year you see lots of surgeries being postponed, or not being are being planned but are not able to happen because of some sort of financial barriers, and they could be generic barriers that we do talk about to get some knowledge and information about how they can affect you and me receiving care from the National Health Service. Now, if we focus down and filter down on some of the barriers that we are talking about related to different stages of our life, then we need to go into detailing of looking at barriers in these 6 stages. So, when we talk about infancy and early childhood age, we do talk about geographical barriers, people living within towns, and there are people which sometimes are living outside towns. So, if they need, say, for example, if somebody is needing initial help and care in terms of ambulance services, or if they're about to give birth, then in such cases they could be impeded by geographical barriers. Obviously, finance is one generic barrier that could be present across all stages, because when we look at long-term care or short-term care, whichever we look at, the local authorities, the councils, and the National Health Service always looks at funding part of it first to see whether this care can be sustained, can be provided, and can it be provided throughout if it is required from a point of view of long-term assistance. Some of the other barriers that you could see in terms of other stages of life that we go through is, for example, waiting times. You look at, in some cases, looking at areas of social, barriers which can be created because of social influences. For example, marginalized communities, when we look at because of discrimination or racial or ethnic or disabled background, and they would be social barriers which people might face because of social stigma or their cultural differences and background. And in some cases, if there is lack of appropriate resources. Now, we could see mental health care barriers, which is again because of people suffering with mental health issues, but because of the stigma or the, let's say, the baggage that it carries around mental health issues, people might not have a good understanding of it. And that would mean that the available support services might not reach that individual on time, and they could be seen as barriers. Now, in terms of sometimes when we do talk about adulthood, if I look at a different age group altogether, we talk about things like, employment barriers, wherein obviously adults have gone through an education and achieved a degree, or whatever, they would face struggles to be able to find full-time work. But at the same time, sometimes you would see people who are working struggle to look at finding healthcare appointments because they would prioritize work between 9 to 5. And when you look at the operating time for surgeries, you normally see that they are not able to get appointments between 9 to 5, which is the working times. And in such cases, you would generally see them as barriers from a young adult point of view. So in some cases, you have to take leave, or you have to obviously look at taking time off to be able to go to your GP to discuss problems or discuss issues, and that would be, seen as barriers with a different age group, but essentially, nevertheless, are barriers. And then, if you look at the later adulthood, then in such cases, barriers could be mobility issues. It could be, chronic conditions or multiple chronic conditions that you might have, and you would need different kind of support. But funding would restrict that support. So whether the council or the local authorities or community care are able to provide you, services for all different types of support, things like mobility support, or social work support, or personal support to carry out some of the activities at home. And in such cases, you could have mobility issues, you could have barriers because of finances with the local authorities, and then in some cases, housing costs, if the council is not able to repatriate into because you live alone and no member of the family lives with you, then in such cases, transfer to nursing homes or care homes essentially could also be facing financial barriers in terms of number of seats or available spaces in the area that you want to go to, and they could be such barriers that we need to look at discussing in this particular assessment criteria. Again, 6 different stages, different barriers which could be classified or categorized across physical, financial, social, cultural, structural, and they would become more complex as you look at talking about different stages of life, specifically middle adulthood and late adulthood. Now, in terms of the last assessment criteria, we are looking at essentially finding out how would you overcome these barriers. So one of the important things is that we know that there are these barriers, but how would you overcome these barriers essentially when we do talk about, the hurdles or problems that we have discussed in the previous, assessment criteria of merit. Now, in order to overcome these barriers, you would obviously look at choosing first a couple of barriers that you think are worth discussing. So, for example, things like geographical barriers or financial barriers, you would categorize them into these 4 or 5 that I talked about: physical, social, psychological, financial, geographical. And then what we want to be able to look at is what could be the various solutions which are available when we do talk about these we or talk about ways in terms of how we could look at overcoming some of the barriers. So when we do talk about overcoming some of these barriers, what we are looking at is looking at in detail some of these barriers, and then with the barrier and the understanding of that particular problem or issue, what we want to be able to do is, talk about how would we look at solving that as a problem, for example. Now, when we talked about lack of information as a generic point, when I discussed that, we could look at overcoming the barrier by providing comprehensive information, could be guidance, could be some sort of educational support services which could be done through the local pharmacy or your GP surgery. And these services, in terms of providing information and guidance, would help in facilitating, for example, some of these services which the individuals might receive. Now, a practical example of that we get to see is that when you do look at calling the NHS or go to the GP surgery, and if you have a physical disability, for example, like sight, you can ask for your prescription to be given in braille or a large print if you have eyesight related disability. In some cases, you would look at now, you could ask for these support services to be provided to you, wherein there are people who are able to speak multiple languages. So support from a cultural point of view, and instructions being available on medication and some of the other things like prescription available in large print or braille would facilitate this lack of information, because if I don't have this printed for an individual in that particular format, then that individual might miss out on what the information is actually providing. If I look at financial support or funding related guidance, then what I would essentially do in that case would be, if funding is an issue, then the idea would be to educate the individuals in terms of understanding how the funding is provided, what support is covered under funding from the government, from local authorities, and what are the areas under which you would need that funding because you're struggling, because of, say, for example, low income or certain things not being made available to you. So in such cases, the cost of services such as subsidies and grants would be the information that you would need to overcome financial barrier. So in some cases, when you look at, when you go and get a prescription and you go to the pharmacy and you're collecting a prescription, normally they ask for prescription charges in all 4 places, Scotland, England, Wales, and Northern Ireland. But you can do away with those prescription charges if you click on one of the boxes, tick on the one of the boxes saying that either you're pregnant, either you're under the age of 16, you are a senior citizen, you're retired, you are on some sort of medical support or income support. And in such cases, if you tick that box, then that funding barrier or that barrier because you require financial support is taken away, because you have information and you can actually tick that off on the prescription. And that would be looking at overcoming, say, for example, financial barriers. So when we do talk about different barriers and how do we overcome that, we have to look at practical examples here of one, what is the barrier and how do we overcome it and why is it considered a barrier? You could explain that very briefly and then say how do we overcome that barrier, and that is what this particular assessment criteria covers. So here sometimes you see that if we are looking at combating stigma and social barriers, training, education, and information becomes more important. But at the same time, data protection, which is basically access to information, also becomes important. So within the NHS, in order to overcome this particular barrier, the NHS does a lot of training programs for the staff on cultural competence, disability awareness, and obviously how to do inclusive communication with patients in order to support them better. Now, combating stigma and social barriers can only be done through awareness campaigns, basically education, and ensuring that enough information is available to all members and all segments within the community so that they are able to understand the other's viewpoint and do inclusive communication in order to better support individuals. So again, this could be social stigma could be a barrier in certain cultures, and that is how you overcome that particular barrier. And overcoming that barrier would require education, training programs within staff, both within the NHS and other authorities which are providing those services and support to the members of individual or individual members of public. You would look at technology now coming to the aid of how barriers can be overcome. One of the simple examples that I would go look at is the hearing in loop. If you go to the bank or post office, and if people with disabilities in terms of hearing, they have the provision of what is called a hearing in loop kind of an equipment at the teller's counter or at the counter wherein they can plug in their microphone, and that allows them to communicate and hear the other individual on the other side of the partition very clearly and in clarity. Now, technology and utilization of technology and digital solutions can offer, a way to overcome some of these barriers. This would be more important when you're in remote areas and you need access to GP services. So GP services in such cases does a remote calling through Zoom or Teams or using one of the platforms, and that allows them to be able to still see their patients and offer services and support which they are not able to do so when they are not able to attend GP surgery or come to the surgery in person when they are living in remote areas. So obviously technology can help overcome some of the barriers related to geographical, I would say access or limiting the access geographically in certain areas, specifically in rural areas. And that would be looking at another example of how technology can help you overcome this particular barrier. So this assessment criteria, what you have to look at is the barriers that we've discussed in the merit criteria. You have to look at discussing how do we overcome. So some of the concepts which have now globally being accepted, telemedicine, telehealth, integrated care systems, use of technology, is helping some of the geographical barriers to be overcome and can be used as an example, to do this particular task. So, any questions on this so far? So that brings us to the end of this discussion of the learning outcome, which basically focuses on, talking about the understanding health and social care provision for different ages and different stages of life. So if you think of any questions, please feel free to write into me at learnerwork@ukversity.co.uk. And obviously, all the new presentations for the learning outcomes are going to be available on Moodle along with the recording of this session just after this session. And I will see you, in the next one, which is on Friday. Thanks for attending.